All right, so this executive order we're talking about, January 28th, 2025, it's titled Protecting Children from Chemical and Surgical Mutilation. Bold name, huh? But let's not just look at the surface. What this does is, it prohibits federal funding for any gender-affirming medical treatments for minors. That means no Medicaid, no Medicare reimbursements for procedures like puberty blockers, hormone therapy, and the rest. And this applies to anyone under 19.
And it's not just the funding cut. This drags hospitals and clinics into the thick of it. If they're offering these treatments to minors, they risk losing federal funding altogether. That's funding for education grants, research, you name it.
Exactly. And let me tell you, this isn't just a slap on the wrist. The Department of Health and Human Services has been instructed to carry out this policy. They're going to go in with regulations and, revise Medicare and Medicaid participation agreements. It's like, well, when you're in the thick of a battlefield and supplies are cut off, you either fall in line or face collapse. That's what's happening here.
Yeah. But here's the kicker, Emeka. This policy isn't just about the healthcare system. It's leaning on the idea of protecting parental rights. They're saying, hey parents, you have the final say in your kids' healthcare decisions. And they're framing gender-affirming care as something that crosses the line into parental violation.
But Duke, the legal framework here is where it gets dicey. This executive order reinterprets Section 1557 of the Affordable Care Act, the section that explicitly protected gender identity in health programs. That's out the window now, and you know what they're using as their shield? Long-term health concerns. The administration's calling these treatments experimental or risky, and that's their justification for this sweeping move.
Right, but let's not forget, the financial implications are massive. Medical institutions, hospitals, clinics, they're caught in a chokehold. Do they keep offering these treatments and risk losing federal funds, or do they stop and stay afloat? And a lot of these places depend heavily on that funding. It's not just a slap, it's a knockout punch.
And Duke, you got to acknowledge the broader implications too. It's not just dollars and cents. It's also about controlling the narrative. Elevating this idea of family values, calling for research into the so-called long-term effects. It's strategic. Whether you agree or not, they're banking on a shift in public perception while tightening the screws on healthcare providers.
No doubt. And the HHS doing the heavy lifting here. It feels like a coordinated strike, doesn't it? They're rescinding prior guidelines, rolling back progress bit by bit. It's systematic, all the way.
Right. And the stakes are real. These regulations have teeth. A clinic stepping out of line could lose Medicare approvals, even research dollars. And let's call it what it is. This isn't just about setting a precedent. It's about enforcing compliance.
And it's cutting deep. Institutions are being forced to make tough calls, all while this debate about autonomy versus parental rights rages on. It's surgical, Emeka. Surgical.
After all that, you can imagine the backlash, right? Advocacy groups and leading medical organizations are pushing back hard, and lawsuits, oh man, they're flooding in. They're saying this executive order stomps on constitutional protections, equal rights, anti-discrimination laws, you name it. And let me tell you, the fight is fierce. These groups aren't holding back. They're doing everything they can to keep this from becoming the new normal.
Yeah, the legal scene looks like a battlefield. These lawsuits, they're not just paperwork. They're shot after shot, claiming this policy steps all over Section 1557 of the Affordable Care Act, which used to protect gender identity. Now, with that shield gone, the cracks are showing big time.
Exactly, Duke. It's a domino effect. Stripping that protection blasts open a path for systematic pushback, but the mental health impact, that's where it gets truly alarming. We're talking about kids here. Transgender youth, who already face skyrocketing rates of anxiety, depression, cut off their access to affirming care, their lifeline. And you're not just pulling at a thread, you're unraveling a whole tapestry.
Big agree there, Emeka. Experts are already yelling from the rooftops about this. They're predicting spikes in self-harm, suicide, all of it, if this care goes out the window. It's what I'd call a collateral damage scenario, preventable but ignored. And let's not even get started on the stigma this reinforces.
And Duke, on top of this mental health catastrophe, you've got the operational havoc for healthcare providers. Hospitals especially, they're getting squeezed. You want to comply and ditch gender-affirming programs? Sure. But that means alienating an entire community, or you resist and lose federal funding. It's like standing between Scylla and Charybdis, truly a no-win scenario.
Yeah, it's damage either way. You've got states where institutions are outright suspending their programs to stay out of firing range. It's survival mode. But then, look at other states. They're resisting like their backs are against a wall, taking hits on funding, risking lawsuits. They're fighting tooth and nail to keep providing care.
And those that comply, standards of care drop. We're talking about a scenario where best practices get tossed aside, all to meet these new directives. Duke, this isn't about improving healthcare. It's a calculated move to reshape the very foundation of it, layer by layer.
Surgical, just like the last chapter. Every level of care is feeling it right now. Federal dollars are an artery, and this order's cutting deep into it, forcing providers to bleed out or suture up on terms they didn't choose.
Indeed. And while the courts are sorting this chaos, lives hang in the balance. The fallout, it's already here. It's Duke. As we look at the driving force behind this policy, it's vital to examine how it aligns with core conservative values. The administration is presenting this as a push for fiscal conservatism, cutting federal spending on what they label as experimental treatments, and framing it as a way to give decision-making power back to parents. The rationale, at least on paper, ties into safeguarding minors and reining in perceived overspending. But does it really hold up under scrutiny?
Yeah. It's classic conservative doctrine. Keep the government small, keep spending tighter than a tactical formation, and lean on family values to guide decision-making. And they're packaging it up as a let parents decide deal. But isn't there a flip side?
There sure is. Fiscal conservatism has its merits, Duke, but only if you're not tossing lives and healthcare standards out the window. This isn't a simple budget cut. It's severing access for vulnerable populations, and truthfully, it invites backlash. Internationally, the perception is already shifting. Many see this as the US taking a big step back on LGBTQ+ rights. It's like running into battle without considering the terrain. It may look decisive, but you leave blind spots wide open.
Exactly. And those blind spots? They're going to cost. Public health is on the line. Sure, you're saving dollars today, but what about tomorrow when the mental health crises spike? Emergency services and community support systems are going to pick up that bill, and it's not going to be cheap.
And Duke, here's where the policy flexes its muscle. It restructures healthcare governance, almost like a military chain of command. By mandating compliance or threatening financial ruin, it centralizes authority. It's strategic. Reminds me of consolidating supply lines. You choke off resources, force alignment, and gain full control of the battlefield.
You've got it. But here's the thing, Emeka. This command approach doesn't translate cleanly to healthcare. Providers aren't soldiers. Dealing with lives instead of strategy maps means the stakes are personal. Every decision impacts real people, not just bottom lines.
Absolutely. And that personal impact ripples outward. Internationally, this damages the US as a leader in human rights. Domestically, the divisions deepen. Progressive voices see this as an overreach, while conservative factions hail it as a victory. It's a cultural tug-of-war with no clear end in sight.
And back on the ground, healthcare providers are left holding the line. They're navigating a minefield of ethical concerns, financial strain, and community backlash. Feels less like governance and more like a forced march through hostile territory.
That's an apt way to put it, Duke. A forced march. And as this policy unfolds, we're witnessing the reshaping of societal dynamics, from how we define parental authority to the very structure of healthcare itself. The question remains, at what cost?
A cost we'll all feel, no doubt. Well, Emeka, we've dissected this executive order from its bones to its ripple effects. It's clear this isn't just about one policy. It's a statement about the direction the country's heading.
No doubt, Duke. And on that note, it's been a ride unpacking this with you. To our listeners, Thanks for sticking with us through this dive into Executive Order 2025. On that note, we'll see you next time on Restrictive Medical Care. Stay sharp.
Stay sharp, folks. Until next time.